Hello, this is Dr. Yazi, and this is the last session in Parotid Gland Pathology station in MRCS Part B. Okay. Here, the examiner actually will ask some freaky questions which are not related to pathology at all. And there are 3 questions. 2 of them will be in statistics. Okay. And 1 question will be in infection control. Okay. So we will start with the statistical 2 questions. He's going to ask you about test sensitivity and test specificity. Every one of them is a separate question, okay? Specificity, okay? So here he will ask you, what is the meaning of high sensitivity test? And there is one, let us say, paradigm that you want to remember, and in this way you will not forget to answer this, because it may look here easy, but inside the exam it looks difficult, okay? So we will make that paradigm for both of them. Your definition will start like this. You will say that if the ability of a test, we are writing this according to the answer that is required by the college, okay? Ability of a test to correctly identify those, and then we will continue. The ability of a test to correctly identify those, then we will see who are those, okay? So a high sensitivity test usually is the ability, when they say that this test is highly sensitive, this means that this test has the ability to correctly identify those with the disease, and this is called true positive rate, okay? So all what you need to do here is to connect this sign, positive sign, with the sensitivity here, okay? Remember that sensitivity means positive, and positive means that the people who are positive for the disease, and a high sensitivity test will correctly identify those who are positively with the disease, okay? So let us go now to the specificity. Specificity is the same paradigm, ability of a test to correctly identify those. Those here in this case, let's read this. Okay, fine. So it is the ability, this specificity now, okay? We are talking about specificity here, and at this time the ability of a test to correctly identify those without the disease, and this means that these are true, this is called true negative rate. That means those people are negative for the disease, okay? And accordingly you want to remember that this negative sign is related to specificity, and always when they say specificity, remember this negative sign, and then you will remember the definition, okay? So this is the first question, and this is the second question. What is the meaning of high sensitivity test? What is the meaning of high specificity test? Finished. So now we will go to the infection control question, and they are going to ask you something related to FNAC. It is not related to it, but they will ask you that your assistant during the fine needle aspiration cytology had a needle stick injury, okay? So what are you going to do, okay? Or what to do, what your nurse or your assistant is going to do, whatever it is, okay? So needle stick injury, most of us know that because we are practicing already. So number 1, there are some steps. You want to say them in this order as I will mention to you, okay? So first of all, press it and encourage bleeding, okay? Press it and encourage bleeding. Okay, so number 2, wash it. You are going to wash it with water and soap. Okay, number 3, contact occupational health department. Okay, this will be done during the normal working hours. So if this happened at night, what are you going to do? You are going to contact the accident and emergency department. Okay, so what is next? The 4th step here is that you are going to counsel for testing hepatitis B and C and HIV. Okay, number 5, you are going to discuss with the microbiologist post-exposure prophylaxis. Okay, 5 points that you are going to do if you had needle stick injury or you have an assistant who had a needle stick injury. Number 1, you are going to encourage bleeding by pressing the wound or pressing the part that is injured. Number 2, you are going to wash the wound with water and soap, running water and soap. Number 3, you are going to contact occupational health department, and if this happened during time outside the working hours, you are going to contact the A&E. Number 4, you are going to counsel for testing for hepatitis B, hepatitis C, and HIV. And the last point here, you are going to discuss with the microbiologist the probability of post-exposure prophylaxis. In this way, this parotid gland pathology station is done.